Welcome to the Body Ethos Podcast, where we're shifting the culture from sickness to health. Before we dive in, please remember that this podcast is for educational purposes only. It is not a substitute for medical advice, diagnosis, or treatment. Always consult your healthcare provider before making any changes to your health routine. Hello, everyone. Welcome to the Body Ethos Podcast, where we're all about shifting the culture from sickness to health. I'm your host, Jessica Whitmill, and today we're diving into a fascinating topic that I think more people need to be talking about, which is how our eyes can reflect what's going on in the rest of our body. Today, our guest is Dr. Christina. She is a functional medicine trained health consultant who combines her deep understanding of vision and neurology and whole body wellness to help people see that health is something that we should look at in a whole person perspective. Today, we're going to talk about how your eyes can reveal early signs of systematic issues and deeper root causes as well, and how this powerful connection happens between the eyes and the brain that I think more people need to know about. So let's go ahead and get started. Dr. Christina, thank you so much for joining us today.
Thanks for having me.
Absolutely. So I always like to start off these podcast episodes with just telling us a little bit about your story. What inspired you to go into optometry and then later expand into functional medicine?
Yeah, so my story is pretty personal actually to me. So I always knew that I liked science, trying to help people, the typical things that make people go into healthcare in general. But my mom actually lost some vision when I was in the 6th grade. And it was something that was obviously really tough on the family. And she didn't have a lot of answers as to why it happened. So growing up, we were really dealing with my mom trying to navigate that, which was challenging. And so it kind of clicked when I was deciding which area of healthcare that I wanted to go into, because it just made sense to me that even if I couldn't necessarily find the cause of her vision loss, but I would at least be able to take care of her and her eyes for the rest of her life. So, kind of a personal story there. Me personally, I also have pretty bad eyesight. So I've been to the eye doctor since I was 6 years old. So it just kind of made sense for me. And so that was really rewarding when I finally became my mom's eye doctor. Then I could really help her. And I knew her whole story and I know what she'd been through. So that's what originally got me into optometry. But I'd also been very much into health and wellness, nutrition, kind of started from, I was in actually the CrossFit world. And that's where a lot of times you get into your nutrition, for performance. So that's what kind of led me into it. But then as I was practicing, I was just really starting to see the connections between the eyes and the rest of the body. And I was getting really frustrated when I would have patients coming in with symptoms. And I knew that could be something diet related, health related, but I only had 20 minutes on an eye exam to just check things and maybe mention a couple of things, but there would be no way that I could dive deeper into what was really going on or truly help them. So I was getting really, really frustrated and burnt out. I feel like this is a common story for people in conventional care. And I was at some different offices and I was thinking it was, different offices that weren't right for me, but I realized it's not the actual setting. It was the entire just conventional medicine just wasn't sitting right with me. So I never will forget the day, but I came home and I told my husband, I'm like, I'm not doing this anymore. And kind of launched myself into creating my business, looking beyond health, functional medicine world, and just trying to get people to be able to look for the root cause of their eye issues and heal from the inside out.
I love that so much. Thank you for sharing that. And I love kind of the origin story of all of this, of your mom's situation, right? And, not wanting anyone to go through something like that. And could there have been something caught early? And, probably so many questions that you've been able to hopefully find some answers to. But if anything, just caring for your mom is so sweet. So I get that. Yeah. Yeah, definitely. I think a lot of us find motivation in seeing family members suffer and wanting that to never be the case for anyone else, but also how do we help them as well? So
Correct.
I think that's so beautiful. And I love that you've expanded now into this functional medicine space with your background. So I cannot wait to dig into some questions around this with you. So you said that before, folks to understand how a healthy lifestyle is really connected to their eyes. And I think you can kind of see even when you're looking at their eyes, hey, this person probably has some nutrient deficiencies or issues going on, some inflammation that's probably very much lifestyle related. So can you talk about what that looks like in their eyes and what the eyes can reveal about someone's health overall?
Yeah, great question. So I had actually made a video about this on my Instagram of me looking at it's called the retinal images that you can have done at your routine eye exam. And I started doing this little challenge with myself sometimes when I was reviewing a client's or patient's chart. So I would open up and look at their eyes and I wouldn't look at how old they were. And I would try to guess. And I'd say, is this a younger person? Is this an older person? Because you can just kind of tell. I'll kind of explain in a minute. But in general, when you open it, eye doctors can just tell, like, oh, this is a healthy eye versus this is not a healthy eye. And what I was finding is that unfortunately, there were some people who were a lot younger and their eyes just looked a bit older and vice versa. So I had some, people in their that their eyes just looked so healthy. So then my favorite would be when I would go in and ask them, I'm like, hey, have you lived a pretty healthy life? And they always say yes. They always say that either they ate healthy. I also get that they walked a lot. They're like, yes, I go on a walk all the time. So it was just really cool to make some of those connections between what I was actually seeing and then kind of looking at the health of the person overall. Call it kind of like the eye health age that you can kind of see this. It's not an official thing, but it's just trends that I was noticing. But in actual optometry, things that we do look at. So when we're looking at the retinal images, the retina is filled with the tiny blood vessels that line the back of the eye. And so we're the only ones that physically can look at blood vessels in the body, which is pretty cool. So when we do that, that gives us a big insight about blood sugar, blood pressure, cholesterol, all of those sorts of things, because unfortunately, people who have diabetes or high blood pressure, there can be damage to those small blood vessels in the back of the eye. Can lead to retinopathy, bleeding, swelling of optic nerves. So there's a lot of stuff that we can actually see. And sometimes us as eye doctors are the first ones that find things, because if someone hasn't gone to the doctor and they don't know that these things are going on, and we see some of this, that opens up the conversation of, hey, we've been to the doctor in a while because we're seeing some of these changes going on. And then just what the overall retina looks like in general, if there's deposits or some degenerations, things like that. So we get a big insight of the entire body by looking at the retina. And then also the front of the eye. So we'll see redness, inflammation, irritation on the front of the eye. And that can also be coming from some more systemic things, which I'll sure we'll get into more of those when we keep talking, but a lot you can see.
Yeah, no, absolutely. Thank you for that overview. I think it's important to understand kind of what, I think we've all kind of been the eye doctor. We've seen kind of like our optic nerve and all of that, but kind of just being like, oh, it's good, and never really knowing kind of like the depth of what you can see and understand from an image like that, especially if you're looking at it from a more functional perspective. And I love that you're actually having those conversations with your patients versus I'm not sure if I've ever experienced that going to the eye doctor. So, and definitely, have been told in the past, there was inflammation and things like that, but never asked about lifestyle. So I think that's amazing how you're making those connections and helping your patients make those connections too.
Yeah, very important.
Absolutely. So I'd love to kind of step through some specific eye issues with you, like we were talking about. So, and maybe some deeper root cause imbalances. So I was going to start out with like dry eyes. What do you typically see with that?
Yes. So this is one that I'm talking about a lot because it's very common. A lot of people suffer with dry eyes. And I just want to give some examples of what dry eyes can be, because people don't always realize, or they'll say, oh, my eyes aren't dry. But some of the other symptoms can be itching, burning, tearing, fluctuating vision, light sensitivity, other things that sometimes then when people start going, oh, I have that, didn't realize that that's what dry eye is, because dry eye has a lot of other symptoms. But in optometry world, dry eye treatment is very localized to the eye, and they're not looking beyond that. But a big part of dry eye stems from inflammation. And so a lot of conventional eye doctors are trained, and me too, from that world, is looking at the little glands that go along our eyelid margin. And a lot of the treatments address specifically that. But where I like to widen the lens and say, okay, but where is that inflammation coming from in the rest of the body? So It's not like you just have this localized inflammation. And a lot of times it ties back to gut health, which that's what we all talk about in functional medicine. No surprise that it comes
Yeah.
from the gut, as many people already know in this space. But if you do have leaky gut, that can lead to inflammation elsewhere in the body. So that can be a trigger of dry eyes is, coming from that gut. Other things are nutrient deficiencies, whether that be because it's not coming from the diet or are we not absorbing it from our gut in the diet? Other things can be, like we said, about inflammation, oxidative stress, environmental toxins is another big one too, which sometimes that will be mentioned a little bit in conventional world, but obviously in functional medicine, we look a lot more at trying to reduce some of those environmental toxins that can irritate, the ocular surface. So it's a big one. There's a lot. I could go on and on, but there's a lot more deeper things to look at.
Absolutely. Yeah, no, that's fascinating. And I'd love to just kind of go down a list of different ones. So, what
Yeah.
about eye floaters?
Yeah. So this is a good one because the number one thing that you will hear is just that it's due to aging, which is somewhat true. I mean, I will not say, there's definitely the literature about that. But from a functional lens, other things that we're looking at actually is blood sugar regulation. So, dysregulation of blood sugar can affect the jelly in the eye. So, that's what floaters are caused by, is the vitreous, which is the jelly inside the eye, starts to kind of liquefy the collagen that's in there. I use the analogy with my patients. It's think of like you have Jello that you just made and it's in the refrigerator and it's hard and it's firm. That's what we want it to be like. But when it starts, it's like if you took it out and it was just sitting out and it got kind of like liquidy, that's kind of what happens to that jelly. And something called AGEs, or advanced glycation end products from blood sugar dysregulation, can cause changes in that collagen, which can then affect the structure. Dehydration can be another one. I keep talking about oxidative stress, but it's just so foundational, and where that comes into play for people who aren't familiar with oxidative stress. It's kind of, like that rust that happens. Think of like on a car. When you have your new car and then it starts to kind of age and rust a little bit, but the antioxidants that you can get in your diet helps that. That's like when you take care of your car, you have your oil change, you keep up with it. But if you're not doing those things, that's what can build up this oxidative stress, which affects not only the floaters, but other things in the eye and the rest of the body too.
Yeah, no, I love that. I've had clients of almost every age mention eye floaters before and how, it's related. And also too, I've heard parasites. I was curious your thoughts on that as well, parasites and eye floaters.
Yeah. So that one is something where I think because there's definitely the more, how do I word this? In the holistic space, there's some people that are very gung ho with parasites, and I use the GI map, so I do know about parasites and things like that. But as far as from a functional lens, I can't at this time say for sure that I see that direct correlation, but I know that's a big thing in the holistic world. But I think I need to see more evidence to kind of convince me, I think, of that one.
Totally. Yeah, no, I think more than anything when I think about it, it maybe is back to that like GI inflammation that they can
Mhm.
cause.
Yes.
Not necessarily that they're in your eyes,
Yes. Although
but
it's very rare, but you can get a parasite in your eye. So not to scare people.
okay. So I guess it is true then. Okay, yeah. I was curious from your expertise on this, that one.
Yeah,
So that's
that
great.
one's rare. We will see that, but you are more in the right direction. That yes, it's actually more of like the dysbiosis going on from the parasites that then causes elsewhere. So yeah,
Yeah, exactly. That was kind of my connection on that
yeah.
for sure. Awesome, awesome. And then like eye puffiness, like dark circles under the eyes types of thing. Kind of see I got some of that going on today. So would love to know
Yeah.
why that happens. And I think it's, some people it's definitely a lot more noticeable and
Mhm.
darker and it's, I think we think of it as like cosmetic, but I think it's a deeper root cause. So I'd love
Mhm.
for you to explain that.
Yeah. So the dark circles, there's obviously a genetic link there. I don't, as we all in functional medicine, we don't like to just blame genetics, but it can play a role somewhat. But then you have to look at the other things that would be making it worse. So a lot of times with the puffiness or dark circles, it can be looking at the lymphatic and drainage system. A lot of times food allergies or sensitivities can cause that puffiness around the eyes, histamine issues. And then a lot of times what I see is in my kind of like regular patient population is people who just are eating, unfortunately, a very processed diet just because they're not eating well and they have a lot of those preservatives and things like that. So that's where we see a lot of just that kind of like generalized kind of swelling. And you can just see it when you unfortunately look at some people and they just look so swollen, kind of like the rest of the body, but specifically that thin tissue around the eyes as well. So those are going to be some of the main things contributing to that. And like you said, it's a lot of times people think cosmetics. So they're like, oh, what eye cream can I get to help? But just going along with everything else, we have to pull that lens back and look at the deeper issue as why it's going on.
Absolutely. Just like acne and hair
Mhm.
growth and all of these different things that seem cosmetic, they're really just red flags for the rest of the body being out of
Yeah.
balance. So I think
Yeah.
it's important having this conversation. And then what about blurry vision or light sensitivity?
Yeah. So light sensitivity is a big one because there's actually a lot of different causes for that. So, number one, like I said earlier, the dry eyes. So, if you don't have a nice smooth tear film on the front of your eyes, it's kind of like I'm a big fan of analogies. I just think it helps explain things to people. But
Absolutely.
when you're driving at nighttime and in the rain and it's hard to see, and then all of a sudden, like your windshield wiper goes and you're like, oh, everything looks so nice and clear. Picture that as every time you blink, you're getting that nice, smooth tear film over the front surface of the eye, which is going to help your clarity of your vision. So, if someone is suffering with inflammation, dry eyes, that's going to disrupt that tear film, which leads to the blurry vision, the fluctuating vision, the light sensitivity. So that kind of ties into both of those. But then other things for light sensitivity can be related to some of the neurological stuff, which I know we'll get to some of that a little bit later. But concussions, migraines, people unfortunately will get light sensitivity from those. Nutrient deficiencies, a big one is vitamin A is associated with that. Can be even like mold toxicity, association with Lyme disease. So there's quite a long list of possible causes. And that was actually one that I really struggled with conventionally because so many people come in and they're like, Doc, I have this horrible light sensitivity. And you do not have, I mean, there's no way you can assess any of that stuff on a routine eye exam. The dry eye, yes, that's usually going to be the main thing that we can do on a routine eye exam. But I hated that I couldn't give people answers for that one because I knew it could be something deeper, even like the sympathetic nervous system too. So looking at those sorts of things because your pupils dilate when you're in that fight or flight response. And we know that many of the world is kind of in that state. So if your pupils are bigger, searching for danger, but nowadays that danger is just, coming from stress and life. But that's going to allow more light into your eyes. So people are going to be a little bit more sensitive to light. So there's a lot of things, but we don't have time to go over that normally on your routine eye exam.
Absolutely. Well, and thank you for explaining all of those different kind of common symptoms. I think it's important for somebody who may be struggling with these things and maybe they are, trying to heal their gut and things like that. I
Mhm.
think it just gives you so much hope that realizing that once you get to that root cause, that some of these symptom wide issues that you may not think about, like your eyes, may also find healing throughout this process. And so it's
Mhm.
worth it on so many layers to go in that direction of eating a healthy diet, doing your healthy lifestyle things like walking and regulating your blood sugar and eating well and taking care of your gut and your body because it really does have far reaching effects beyond just even just feeling more energetic. It's like you can actually like heal your eyes and you can,
Yeah.
support your brain and longevity. And all of us want to preserve our eye health as we age for sure. So
Yeah.
I think it's just really, really important to think about. And also, I think some people just kind of don't really, they kind of pass it off of, oh, my eyes are dry or oh, my eyes are sensitive sometimes, but they're not thinking about those deeper root causes to it. And so
Yes.
this is very illuminating. Thank you.
Yeah. Yeah. Love the eye puns.
I know, right? They're just coming to me. I came up with that one on the fly, but it's just so fun. I liked how you said earlier, like looking at it from a wider lens. I was like, ooh,
Yeah.
that was a good one. Yeah.
Yeah.
So now let's talk maybe a little bit about nutrition. What are some key nutrients? I know you mentioned some key nutrients like vitamin A is really important for the eye. But what are some key nutrients that support vision and neurological health? And what are some common nutrient deficiencies that you see that contribute to eye problems?
Yeah. So, like we said, vitamin A is big for the ocular surface, but also night vision. So, if people have issues with night vision, again, there can be other reasons for that, but that is something to look at. Omega 3s are really huge in the eye world for a few different reasons. One of them goes back to the whole dry eye. When I was referring to the little glands earlier, those glands produce the oil component of your tears. And unfortunately, a lot of us who are eating a very poor diet, with not the best oils, we're not getting enough of the omega 3s into our diet. So that can directly affect the oil production in our glands. But also, we know that omega 3 is great for anti inflammation and brain health, coming specifically from DHA. So that one's pretty big for eye health. Antioxidants are huge, coming from vitamin C, vitamin E. The antioxidants, lutein and zeaxanthin, are big ones that you'll hear very often in eye care. One for prevention of macular degeneration, but again, also at the ocular surface and all of those sorts of things as well. B vitamins, as we know, are super important and are very important in methylation and our brain health. And of course, magnesium and minerals are one. So all of these, as I list them off, what people will realize, especially people in the functional space, is these are all things that we need to support our full body health that we're talking to people about. So it's not like there's one secret nutrient for the eyes per se. It's actually just all of the same nutrients that you'll need for your overall health. And that's one of the biggest things I try to get through to people, especially when my patients or clients ask me that, because I think they want like one magic pill or one magic supplement even for eye health. But a lot of them are just the basic nutrients that we need for every other process in the body.
Absolutely. Yeah. It's such a good reminder that we're supporting our whole body with these
Mhm.
nutrients, even our eyes. Thank you for that. And then thinking about the eyes also like as an extension of the brain. I know you talked about, omega 3s and how that's important for the brain and so many of those other nutrients you mentioned as well. But I don't think people always think about that connection right away that our eyes are truly an extension of what's happening in our neurology. So can you explain about that connection and how vision can actually tell us a lot about our neurological health or even our emotional well-being?
Yeah, I absolutely love this question, and I have a lot of things to say about it. So I'm
Yeah.
going to try to keep it, not too long. But there's actually a lot of things that are tied to this. So number one, just some background for people, but how we say that the eyes are a connection or an extension of the brain. So when you're developing, that's literally your eyes are an extension of the brain tissue. So I just really like to remind people of that, and specifically the optic nerve. So we describe it as the little cable that connects your eyes to the brain. And on an eye exam, we are looking at the very top of the optic nerve. And so we can get a lot of information from what's going on, behind the eyes from that optic nerve. So sometimes eye doctors are the first ones to find some scary things going on, like swelling in the brain, tumors, unfortunately, strokes, MS. So there's actually a lot of things that we can see if we see something abnormal in the optic nerve, even though we might not be able to say right then and there on the eye exam what it is. But then we would obviously refer for some imaging to then see what's going on. But often, unfortunately, eye doctors can be the first ones to find some of these things that are going on in the brain due to that optic nerve. Something else that's really interesting that's coming up in the eye world is that they're starting to study the retinal nerve fiber layer thickness of it and how it's associated with Alzheimer's, which is really fascinating. So there are some studies that are showing that people who have a little bit of a thinner retinal nerve fiber layer can be associated. They still need more research on this, so it's not something that is definitive or we have specific guidelines with yet, but it's just really fascinating to say, oh, wow, we see this potential cognitive decline coming from the eyes. And can we use that with some imaging that we do or that we already have in the office to be able to see if that's going to be a risk? So I find that really fascinating in that world. Another one is looking at concussions. So People forget that 70% of your brain is related to vision in some way. People always think that vision is just what are you seeing, but they forget about the visual processing, right? So when you're reading something, how your eyes are tracking, how they're moving, the memory that goes into that, the visual processing time, the spatial awareness, those are all parts of vision, but also they are all controlled by different parts in the brain. So we will also see people who have concussions that really suffer and struggle in those areas. And even if it was just a minor concussion or something that someone might not even have been diagnosed as a concussion, but they hit their head, and then they're having some of these symptoms, but they were never, wasn't bad enough to go to the hospital or get a diagnosis. But that can cause a lot of issues with your eyes and your vision. And in kids, we'll see that there's a lot of dysfunction going on as far as with reading that will get almost potentially misdiagnosed as ADHD because we don't realize that their eyes aren't focusing, tracking, working well together as a team. And picture if you're trying to read something and your eyes aren't going to work together, no wonder you would look up and look out the window, right? Because your eyes and your visual system can't do it anymore. So that's a whole nother field that kind of links the eyes to the brain. And then another hot topic right now as well is that blue light and sleep regulation. So our eyes are the window to what receives light. And that connection then creates hormones that signal this whole in the circadian rhythm. So things like melatonin. And as we all know, and this is why it's being talked about a lot, is all of the artificial lights that we have. People aren't getting outside in the sun to regulate the circadian rhythm. And your eyes are what is that, tool that's really observing all of that. So if people aren't looking at that morning sunlight or you're spending too much time scrolling your phone at the evening, that's going to be things that mess up that whole circadian rhythm, which then will affect your sleep. Your sleep is affected. You're going to get those bad dark circles under your eyes. And it's just everything that I say, I kind of can link back to something that we've said before. Totally. Because it's all just so interconnected to that. So there's quite a laundry list. Like I said, I could go on and on about that, but there's so many things that relate to the eyes and the brain.
I mean, it's so fascinating, right? It's things that I've not even thought about as far as like the ADHD and the reading issues that some of these kids have. And I think it's important. I could talk about concussions all day because I think it just really is something that a lot of people don't realize. And I think a lot of us have probably experienced, but it wasn't treated properly in that moment or in time. I still think that they don't treat TBIs as, as much as they should or take them as seriously as they should, especially in children. And this can have far-reaching effects. So I think it's important, all these things that you brought up and just how important your eye health is for even monitoring some deeper, scarier diagnoses as well, and just how important everything is connected in the body. Like you were saying, tumors and MS and Alzheimer's, these types of things, it's all connected. And so I love how you kind of brought that all around. So thank you for that. We could probably listen to you talk about this all day. I know I could. It's so fascinating. I did want to also mention too, so as far as like somebody listening to this today and they're like, okay, like I have eye floaters, my child had a TBI or I know I have gut issues and also I have like light sensitivity and, all these different things are connecting. What are maybe some practical steps and impactful changes somebody can make today?
Yeah, that's a great question. So, number one, we always have to, of course, rule out something more concerning going on. So, I always say to people even in the functional space or who like to look at things more holistically, but it is still really important to go and have a physical examination of your eyes, even if it is from somebody that might not be looking broader at all these. Just to touch on like the floaters, I was talking about, of course, some of the more root causes once the big things are ruled out. But if someone all of a sudden gets a floater, it is really important to have that evaluated and make sure that there isn't something more concerning like a retinal hole or a retinal tear. So first things first, if you ever notice any sort of change or something in your vision, definitely have your eyes evaluated just to kind of rule that out. I feel like I always just want to be safe because we only get one set of eyes. And that's why I'm so passionate about this topic, because it really is the number one sense that people do not want to lose, but for some reason take for granted. It's just something that people are like, yeah, I can see. And they don't think twice about what's going on behind the eye. So when in doubt, always have an evaluation. And then if everything checks back, everything looks good, you look normal, then that's when we need to dig a little bit deeper. And specifically to go back with the concussions in the kids. So, because sometimes parents don't know what to do, or they might not see an eye doctor that specializes in that. But there are eye doctors that specialize in something called vision therapy, which is like vision, or think of like physical therapy, but for the eyes. They're usually called like a behavioral optometrist, or there's an area called the COVD is an area where you can search for specific eye doctors that specialize in these things. So I just want to put that out there for if parents have some kids that they think they're struggling, but they don't know who to go to. There are eye doctors that specialize in this. And then the basic thing for everybody, and this is the boring answer, but it truly is starting with that nutrition. Everyone always wants the fancy answer, but as we've already mentioned, why it's so important because of the many micronutrients that are involved in protecting the eyes and the eye health. And so you definitely need to start there. So if you haven't started anything yet, let's start with that nutrition. Let's get you eating enough protein, whole foods, limit those processed foods, get a lot of foods that have those nutrients we talked about earlier. And then you can move on to the other things, the lifestyle, the sleep, and then kind of like the nerdy stuff that of course, the people in the functional and holistic space love, like mitochondrial health and reducing oxidative stress and all of those sorts of things. Those are going to be things that can help, but we don't want to jump to the fancy stuff, if you haven't covered your basics. And I feel very strongly about that, even if it's a boring answer.
No, I love it. I love the boring answer because I believe the same thing, right? We can't out supplement diet and lifestyle. So, I mean, those are the foundations. They're the foundations of anything that's going on wrong in the body is going back to those basics of making sure you're, like you said, you're getting enough protein, you're well hydrated, you're getting your minerals, you're going outside, you're getting adequate rest and sleep, and you're managing stress and blue light mitigation. I think if we all do those things, we would be much happier and healthier as a society, and we wouldn't have some of these symptoms, right? Because symptoms are always just a messenger. And I love what you said too about our eyes, just not taking them for granted because we only get, one pair. And just like our teeth, right? We have to take care of our oral health, our eyes, so many different things. And I'm all about getting those regular appointments as well, and just making sure that we're monitoring things and keeping things healthy. So I think that was awesome. You recommending that as a first step always, if there's some sort of symptom, to rule anything more serious, and then start going back to how do we support the body for optimal health. So that was awesome. Thank you so much. Anything else you want to add on that regard?
No, I think that's everything. Thank you so much for having me. Love that all the questions that you asked. I love talking about this topic to try to get that lens out there, not to keep doing the eye puns, but for people to really just start thinking about their eyes and why it's so important. I can't tell you the amount of people that tell me that they have good vision, so they don't need to go to the eye doctor or worry about these things. Or vice versa, people who don't necessarily think they may need help because they can see well, but there's a lot of stuff that you can't see. And the prevention side of medicine is there's nothing that's going to make somebody really want to fix or prevent something, right? But it's so important because when I unfortunately see people in, their 60s, 70s who have macular degeneration or glaucoma or diseases of the eyes that unfortunately could have been prevented, that's something that kind of always breaks my heart because they may not have cared enough because there wasn't a problem, if that makes sense. I really like to get the preventative information out there, and so that people don't take it for granted.
Absolutely. And aware that there's a connection there as well, right? Between blood sugar and glaucoma or nutrient density and some of these other issues that are breaking down the eye and causing degeneration. So I love that. Yeah. Thank you so much, Dr. Christina. I do want to end with one question that I ask every guest on the Body Ethos podcast. But in this space, of course, we're all about helping people take meaningful shifts and ultimately shifting our culture from sickness to health. So, what's one or even two practical ways that people can start doing that today?
So I feel that I have to put the eye spin on it, of course, in my answer.
Sure.
So let's work on getting that morning sunlight. That is one that is huge and that people really are not doing enough. So just getting outside and looking at the sun, it doesn't have to be that long. It can be 5-10 minutes. And if that's really challenging, because unfortunately some people's schedules don't allow that, but trying at nighttime to put those phones down, let's put some of that artificial light off. Let's get back to our bedtime routines that you need to do for children, but we don't think about we have to do them for adults as well to promote that sleep and that circadian rhythm, because that's going to be foundational for so many other things.
I love that. Thank you so much. Such a good reminder. Well, thank you so much again, Dr. Christina, for joining us today and just sharing your wisdom and passion about this topic. Kind of another eye pun here, but seeing the big picture of health, right? Through this lens. And so if as a listener, if this episode inspired you, don't keep it to yourself. I encourage you to subscribe, leave a review, share it with someone who might be trying to look at their health in a new way or experiencing eye problems themselves. And if you want to learn more about Dr. Christina and her work, there will be links in the bio so you can connect with her. And I'll also link to some of the resources that she mentioned in this episode as well. But remember that healing really does start when we get to the root cause. And this is definitely one of those areas where it's overlooked in the root cause space. So thank you for bringing that to us today on this episode. Until next time, I hope that everyone just stays curious about their health and about how we can keep shifting our culture from sickness to health together. Thank you.